Radon is not only technical problem, it's also a socio-technical and psychological problem. And in this case, communication has a really big impact. In this presentation, I will talk about communication about the radon at home and present main pitfalls and recommendations. I'm Tanja Perko from Belgium Nuclear Research Center, and in this presentation, I will refer to the preliminary results of the new European project with the name RadoNorm. There are quite some legal requirements for communication and engagement in Europe and also worldwide. For instance, European Commission, they published Basic Safety Standards Directive in 2013, where they request from every member states to develop a strategy for communication to increase public awareness and inform local decision makers, employers, and employees of the risk of radon, including related to smoking, of course. Also, this legal requirement requests from the member states to provide as appropriate for the involvement of stakeholders in decisions regarding the development and implementation of strategies for managing exposure situations, for instance, radon. These requirements are aligned with the World Health Organization and revised general safety requirements of the International Atomic Energy Agency. Of course, also with Drinking Water Directive published by Euratom. So the legally member states and regulatory authorities, they are requested to communicate and also engage with the stakeholders. Our IRPA new practical guidance for engagement with the public on radiation risk also gives some guidelines how to communicate about the radon. Especially, there is a special chapter dedicated to radon risk communication. Kindly invited to see some practical tips and tricks how to communicate about the engagement. However, what is the status of radon communication campaigns? Here, we found out some preliminary results from the two different European projects, among other also EU RAP project supported by DG Energy of European Commission. And we found out that some countries are still transposing the European legislation at national level. Most European countries are still preparing for implementation of these legal requirements, and only a few countries have communication plan, mainly designed on gut feelings by radon experts, but the health communication experts or social science and humanities scientists are barely engaged in communication plans. That's why also probably a lot of challenges that they are authorities faced with radon communication campaigns. For instance, challenges related to the complex topic which radon is, and also scientific terms. For instance, how to frame radon gas or radioactive gas. We know that if we say natural gas, it means that people will accept it more and they will not take potential actions to protect themselves. But if we say radioactive gas, then the perception is completely different and can also sometimes be wrongly reflected in the behavior of people. Or how to explain what is the reference level, or explain what is 200 to 500 becquerel per cubic meter, or how to explain additional risks of radon. Especially if we know that people are low, they have low numeracy. It means that they have difficulties, most of the people, to understand numbers and measurements. Or how to explain why to use a passive detectors, or how to develop maps, which color, what borders. In some countries, they present the radon mapping on the administrative borders. In some countries, only the points where they measured the radon map. So it's completely differently presented in different countries. So it's difficult for people to understand what exactly is the risk of living in particular population. How to explain in which indoor air quality measurements radon is included and in which not, or how to deliver the message to homeowners without scaring them. We know that if people are scared, they they turn away, they deny the risk. And how the problem is also quite often that in most countries, communication of results from measurements campaign is not prepared in advance. Countries are preparing measurement campaigns, but they don't think in advance how they will then communicate the results, especially if these results are high. We have experienced a lot of problems or challenges in different countries due to high measurements, high radioactivity or radon evaluation in schools or public places, and how to communicate this should be prepared in advance. There are also different challenges due to organizations and systems. Different organizations and authorities have shared responsibilities. In some countries, these are nuclear safety authorities with the Ministry of Special Planning or Ministry of Health. How to help to each other and still drive the same communication plan. Or this connection between risk assessment, risk mitigation, and risk communication is also additional challenge. Or extremely low interest and participation at stakeholder events. For instance, authorities, they know that they need to engage with stakeholders related to the management of radon, but on their events, people, they don't appear, they don't have they have other obligations, other risks more highly prioritized. Or collaboration between national and local levels, and also integration of radon mitigation in different governmental programs, for instance, anti-smoking program, energy efficiency program, or indoor air quality programs. Communication campaigns were conducted in last decade with the goal to increase radon awareness and threat perception. In this case, a lot of communication campaign, they were faced with a gap related to awareness and action, value action gap, we call this in psychology, where people, they are aware of something, but still they don't do anything about this. And we need to address the behavior, and to effectively change the behavior related to radon, we need to tackle different levels. We need to tackle with our communication individual, personal level, interpersonal level, organizational level, community level, and societal level. Only holistic approach, holistically seeing this problem, will bring the changes in the behavior of people. But not only this. In communication, the communication process goes in different stages. First, we are unaware of the issue, but then when we are aware of the issue, then we need to decide what we will do about this issue, acting about the issue, then decide to act, and then we need to maintain this issue. With our communication campaign, previous communication campaigns, we tackled only the first level, increase the awareness. And this is also requested by the legal documents. Increase the awareness. But if we are going to focus only the increase of the awareness of radon, we will skip all the other really important levels of the behavior change. And for these things, we need to recognize that behavior change is needed, that it's desirable. We need to motivate to make this change. We need to make people that they believe that the change can occur, that they are able to change and also maintain this change. We need to trigger cues to initiate change, and we need to communicate also perceived benefits of that change. For instance, if we communicate that they need to build in the house additional ventilation system, we need to communicate what is the efficiency of this additional ventilation system for the radon, for instance. In our communication, we overlooked and often not communicated about subjective norms. This what important others we do. For instance, if I live in the radon-prone area, it's really important for me that I know that my neighbors or my family would do the same things, and this can influence my action, my behavior. We didn't communicate descriptive norms, beliefs about other people's behavior. We didn't communicate about the perception of efficiency regarding recommended responses. We didn't address enough in our communication attitudes, past behavior, or moral norms, that it's morally good that you take care for the radon measurements and protect your family, or self-efficiency, that we didn't put enough attention that people would be feel that they can do something, that they would be able to find the remediation company that will do this for him, or measurement and so on. And risk perception, and of course protective efficiency of an action. So a lot of unimportant factors that we know from health communication, that they are influential, we didn't address in our radon communication. So to conclude, to officially change behavior, and we need to change behavior not only to increase the awareness, we need to tackle different levels. For this, we need multidisciplinary and transdisciplinary approach. In September last year, we started an important project, RadoNorm, supported by the European Commission. And in this project, one work package is completely dedicated to societal aspects, where our experts from the social science and humanities will investigate in particular this value action gap that I presented just before. But our experts from social science and humanities, they work closely together with the dosimetry, with the exposure situations, with the mitigation, effects and risks. And of course, then at the end, they will also together in the multidisciplinary way write recommendations for implementation. Why I wrote also here transdisciplinary, we found out that there are already some ongoing citizen science projects where the ordinary citizen also contribute to building the knowledge related to radon. And together with the experts, they not only educate each other, but they also change the behavior. If you need some advice from social science and humanities, we have a strong capacity collected in the SHARE association. You see here our logo. This is the social science and humanities in ionizing radiation research. Please feel free to contact us and we can give you advice or collaborate together with you on your radon communication challenges.